So yeah, my name is Ryan Harp. I am a postdoc at Northwestern, which just basically means that I recently graduated just a year ago from the University of Colorado. So I'm actually still in Colorado right now. So didn't move in the middle of all this, but yeah, so I study the links between climate and human health. I'm actually a atmospheric scientist by training, so coming at it from that side of things. And if you are interested in reaching out, you can always email me or here's my Twitter or website. And I guess since there's only a handful of us, and I'm the only one, I think we'd save questions to the end. But if something is puzzling, feel free to chime in, and we'll just do it that way. But all right, I'll kick things off here. So, what do you think of when you think of climate change? So I think a lot of people think sea level rise. This is some flooding in Miami, or maybe they think of, really, really intense heat waves. A lot of people think of polar bears or extreme weather events, things like hurricanes. But something that's been getting more attention lately is the fact that climate affects our health. And before we get into that, we'll go through a few examples. Just want to take a step back and just kind of talk about why this might be the case. So as probably all aware, greenhouse gas concentrations have been rising over the past couple centuries. So this is a picture of, or just showing greenhouse gas concentrations steadily rising over the last 6 decades or so. And the first measurement taken in Mauna Loa, Hawaii, which is kind of like the gold standard of our carbon dioxide measurements, was 313 parts per million back in 1958. And that has gone up almost a third in 6 decades to 420 today. So it's a really dramatic increase. And as you can see, it's very steady and continues to rise. And of course, as we add in these heat trapping gases to our atmosphere, temperatures have been rising around the globe. So this is just looking at the average temperature for the entire globe over recent decades. You can see how really, especially in the last 4 or 5 decades, temperatures have really gone up pretty dramatically. And we expect this to continue. So this is just some climate model projections of what temperature might look like in a kind of low emission scenario where we don't burn a lot of fossil fuels, or an extreme one. And as you can see, we have a pretty wide range of potential temperatures in the future. And so this kind of comes down to what we want to do about it and how much we want to try to shift away from fossil fuels and things of that nature. So right now we're pretty much have already exceeded this low projection here. And we also, this extreme projection is also pretty unlikely. We're kind of in the middle. And what we do with that is kind of going to be up to us. But these are just kind of big global numbers. And climate change is a global phenomenon, but what really matters is what happens locally. So on the top here, this is looking at the change in temperature, just kind of one potential outcome, but change of temperature by 2100. As you can see, we're expected to see warming pretty much everywhere, but exactly how much we see depends a lot on the location. So land tends to warm up much faster than the oceans, and the Arctic in particular warms up really rapidly as we lose sea ice moving forward. Down on the bottom here, this is looking at the change in precipitation. So while we see pretty uniform warming around the globe, the change in precipitation and how much rain and snow we see is going to vary a lot more place to place. So you can see that kind of areas around the equator here in this green color are places that are going to see more rain or snow, along with up in the Arctic. And then places that are in this brown are places that are going to dry out a little bit more, not going to see as much rain. And kind of the varies a lot place to place, but the general rule of thumb is that the wet are going to get wetter and the dry are going to get drier. And the particulars here matter a lot. So if a place gets a little bit warmer versus a lot warmer, or gets wetter or drier, it's really going to have an impact when it comes to the actual impacts that we're going to see. So things like the health impacts that we'll dive into here. So this is going to be kind of a lot of information in one shot here, but just to kind of kick things off. So in the middle here, we see kind of the driver here. We see climate change, where we have rising carbon dioxide levels, rising temperatures, more extreme weather, rising sea levels. And that kicks out into a number of different categories of different ways that climate change can impact our health. So it can do so through air pollution, changing amounts of allergens in the atmosphere, water quality is going to change, extreme heat, even our food supply and the nutrition value of the food that we're producing. So all of these different categories are going to have, there we go, a lot of different ways in which they can affect our health. And so don't worry about the details here. I'm just kind of throwing it out here so we can see all of what, all these different possible connections. So we can see, changes in allergies and asthma due to changes in the amount of allergens in our atmosphere. We can see changing rates of malaria, Lyme disease, things we'll talk about in a little bit, heat-related illness and death from extreme heat, which is probably the most straightforward connection between climate and health. And so there's just all these different ways that we don't really think about when we think about climate change, but all these different ways in which the climate, through a bunch of different ways, is going to impact our health. So we're going to dive into a few of these. If you have any questions on some of these other ones later, feel free to ping me and I'll try and see what I can do. But we'll start with extreme heat. So this is, like I said, probably the most straightforward way in which the climate impacts our health. So one particular example, in 2003, there was a major heat wave which hit Europe, in particular, hit France particularly strongly. And Europe in general doesn't have as much air conditioning prevalence within their homes. And so it's an area that's more susceptible to extreme heat than places around the US might be. And so one study noted that climate change increased the risk of heat-related mortality in central Paris by about 70% and by about 20% in London. And in all, it contributed to about 70,000 excess deaths, which might not have occurred if we were not seeing warmer temperatures associated with climate change. And really, we can just think about climate change in this particular example as something that's shifting the risk, and it's shifting the likelihood of these extreme heat waves and how often they're going to occur. I think this is a really good example here. So it's showing, this is just showing temperatures and showing kind of this before climate change, and then this is after. And so you can see that there used to be, or we used to have this distribution where we'd see extreme colds and we'd see extreme heat. And as climate change kicks in and the globe warms up, we still can see extreme cold, and like we used to see extreme heat, we still see that, but the likelihood of extreme heat occurring is growing much higher. And not only are we more likely to see extreme heat, but also the magnitude, like the real extremes, is also pushing further and further to our maximum. And I think this is a really good example of just kind of how we're just shifting the likelihood of things occurring with climate change. And increasingly, more vulnerable people are being exposed. So this is an infographic by The Lancet, which is a British medical journal. And they noted that in the year 2016, there are about 125 million more people than in the year 2000, million people over the age of 65 years old who are the most vulnerable to heat waves. And yeah, sorry, I kind of chalked that one up. But yeah, we're just seeing a lot more people who are vulnerable, who are being exposed, and that's just going to increase as we move forward in time. So another way in which climate impacts our health is through vector-borne diseases. So if you're not familiar with what a vector-borne disease is, things like malaria or Lyme disease are diseases which they aren't transmitted directly from person to person, but they need a vector or this intermediary to take that disease and move it from person to person. And so I wanted to bring this slide back up because, again, we're just thinking about kind of the subtleties of how precipitation and temperature are changing, and these subtleties can have a really dramatic impact on exactly where these different vectors can live. So for instance, this is showing the range of mosquitoes from 2019 to 2080 and how it might evolve in one particular example of one particular projection of climate change. So you can see that the northernmost range here shifts pretty dramatically, where places where mosquitoes used to not be able to live and transmit disease, such as up here and into Canada and far northern United States or northern Europe and Asia, are now places where mosquitoes can live and transmit disease. And there's also areas such as like here in Africa, where as it gets warmer or potentially drier, maybe there aren't as many mosquitoes around due to the changing habitat of that area. And as one particular example, just in Chicago, just over the last 3 decades, we now see 16 more mosquito days per year, which is climate central to this analysis. And they basically found like, okay, what are the temperature and humidity ranges for mosquitoes, and what's most like, or what are the best days for them to be out and about. And that's gone up over 10% just in 3 decades, and is likely to continue to do so. And as a example of kind of a more visual example of how exactly the range could be changing for the disease itself. So, we're just looking at the range of mosquito. Now we're looking at Lyme disease and the cases of Lyme disease in 2001 here on the left and 2014 on the right. So each dot here represents one case in that given year. You can see that not only are there a lot more cases in 2014 than 2001, which could be due to a number of factors, but the range here, I think, is the most startling thing. And so, looking at northern Minnesota or, the upper Northeast, upstate New York, places that previously saw very few cases now see quite a bit. And in fact, Canada used to not see any Lyme disease at all, but over the last decade or so, it's now a disease that exists there and that they need to think and worry about. And so this is just another example of how ranges might be shifting due to our shifting climate. So now we're going to talk about wildfires and air quality. So like I said, I live in Colorado, and last year you might have heard we had some wildfires. There were a ton in California as well. So this is one example, the East Troublesome Fire, which grew to become the largest wildfire in the state of Colorado's history. It's up by Rocky Mountain National Park, if you've ever been up there. And this is a time lapse, and I think it's just a pretty crazy visual here of just how dramatic this fire was when it was growing at its peak. So of course, there's threats to property here. People are pretty close. It did a lot of damage to Rocky Mountain National Park itself. But obviously you wouldn't want to be breathing that smoke, right? That would be pretty awful and would make you pretty ill. And that's what we're focused on here in this context of climate and health. And of course, this seems like it might be a local impact, but I'm going to show a couple of satellite images here which show just how far the smoke can travel. So this dark gray here, this is showing the smoke from that fire. This is kind of zoomed in over Colorado, but you can see that smoke over the clouds here impacting the northeastern part of the state. And that travels and carries. It doesn't mix out very quickly. So you can see these gray streaks all the way into the Midwest here, to Minnesota and Wisconsin. And it even made it all the way to the boot of Italy. So it's pretty crazy just how far this smoke can travel. And of course, as it does so, it can impact our health as well. And it does so by what's known as particulate matter. So particulate matter is just these really fine particles that are seen in smoke or other pollution, stuff like that. And of course, it's going to cause asthma attacks and breathing problems. It's going to irritate your eyes and your throat and stuff like that. But also the really fine particles can penetrate your bloodstream and worsen heart disease or even lead to premature death. And so this particulate matter from the smoke is just really harmful. And how this ties into the climate is that as our climate has been getting warmer and in particular drier in certain parts of the West, we are seeing forest fire increasing, and like not only the number, but also the area burned. So this up here is showing the number of acres burned over the Western United States, or probably the entire United States, but really the West, over the last few decades here. And you can see that the number of acres burned has almost tripled since the 1980s. And of course, another factor is poor forest management, but also, like I said, drier vegetation is something that is playing a key role here as well. Also things like changes in ecology. So there's, again, changing the range of beetles, which kill invasive beetles, which get into our trees and kill them off, which once they're dead are a lot more flammable. And then also just urban sprawl as well, giving more people a chance to ignite fires. But not only is wildfire an impact to our health, but also just the pollution that's being given off by the burning of fossil fuels itself. So we have the potential for massive health benefits from cutting out fossil fuel burning. So a couple of studies found that human-caused PM 2.5, or that particulate matter that I mentioned earlier, causes up to 100,000 premature deaths per year in the United States, or up to 4 to 5 million worldwide, which I think is just a pretty startling number. And other people have looked at, how much this costs, and they determined that the economic benefits of avoiding just the health impacts from the air pollution from burning fossil fuels outweighs the cost of mitigating the emissions themselves and stopping burning fossil fuels by a factor of 2 to 3. So this is a potentially really impactful step that we can take. So I've talked through a few different examples, but what does this all mean? So this is the head of the World Health Organization, and a week or two ago, about 1,000 doctors and medical professionals gave him a letter signed talking about the risks of climate change on our health. And he noted that the risks posed by climate change could dwarf that of any single disease. And of course, he's saying that in the midst of a global pandemic. So, this is a pretty weighty statement. And he also put out this video talking about how climate change is the greatest threat to global health in the 21st century. And I think that is, very a true statement. But I think that the way I like it framed better is this quote by The Lancet, which I mentioned earlier, British Medical Journal. But they noted that tackling climate change could be the greatest global health opportunity of the 21st century. So we have the chance here to take action and limit and mitigate a lot of these health impacts that I've been talking about. And I kind of alluded to this before, but these are really expensive impacts. So there's a report that came out just last week, which estimated that the health costs of climate are up to $820 billion per year just in the US, which is just a crazy number to think about. It's on the order of what the US spends on its military every year, which, as we all know, is an insane number. Just to put it into further context, if you bought all of the Chicago sports teams, that's about $13 billion, 60 times that every single year just in health costs from climate. So I think it's a pretty insane number. So just to wrap things up, like what have we learned here? We talked about our climate's changing, and again, kind of how it changes in particular areas is a very important factor for how climate impacts our health. Those changes affect our health in many ways. So we talked about heat waves, we talked about vector-borne disease and malaria and Lyme disease and pollution and air quality and things like that. And it's also vitally important, right? So we have the potential to save millions of lives by acting on climate change. And in addition to that, we also have a huge opportunity to save a lot of money in healthcare costs. So that's all I got. And yeah, happy to take any questions.
It's daunting, but anyway, yeah. But I think it was a good presentation, but it was, scary in parts and everything, but no, it was informative. Thank you.
Thank you. You're welcome.
I have no questions at the moment, but yeah.
As someone who studies climate and these impacts, there's a lot of mental gymnastics that you have to go through to try and not get too bummed out, and you
Yeah.
have to mentally distance yourself from time to
Well,
time.
the map too of the things like Lyme disease, because I know I have a nephew who got it about 20 years ago near Lyme, Connecticut, but just to see, things like that of the spread, that's pretty fast, and those are
Yeah,
interesting too. But yeah,
yeah,
my son is a geology major these days, and a lot of what is being offered up in terms of, whatever, climate change is obviously such a huge component in so many things.
right.
It's hard to remain optimistic, I think. I don't know.
Yeah,
Hey, we got to do it.
right. We got to do what we got to do, but yeah, it's not happy to think about.
But I appreciate your, I thought, there were some interesting things in there that I don't think I'd thought about, or the slide too that showed the hot and the cold and how we're just so much closer to the hot anyway.
Mhm. Yeah, I really like that animation. I think does a really good job of just showing how, we can still see extreme cold, but it's a bit more
Yeah.
unlikely. And we saw
Yeah.
extreme heat before, but now we just are that much more likely to see it, and the extremes are going to be that much more extreme. So,
Yeah.
mhm.
But good to, see your presentation anyway. And also, yeah, try and do something. Yeah.
Yeah, for sure. I know usually I like to try and put in something hopeful and something that people can do, but um, I guess it didn't work its way into this presentation. So
Yeah.
sorry for ending or for being a little bit of a bummer, but I guess we talked about, it's an opportunity.
It is an opportunity. It's just why we can't try to have people look at it that way instead of something that someone thinks they have that they're going to lose anyway. Yeah.
Right.
Their car.
Yeah. It's going to be expensive no matter what. It's just
Yeah.
how it's going to be expensive.
Yeah. Anyway, thank you.
Joan made a really great point too in the chat that we hear so much about it affecting the environment and the polar bears and like other things. It's really not as advertised to the public about like the health effects on us. So this is really interesting to hear.
Yeah, definitely.
Yeah. And I think it's something that's becoming a bit more well known. I mean, obviously I'm pretty plugged into it, so I see whenever anything comes out on the topic, but I've been studying this for 5 years or whatever, and back then I feel like no one knew about it at all. And now at least it's trickling into the the greater
The
media.
smoke and fire stuff for people is a clear problem, and I think you hear about that. So, but also just heat in general, just that sort of almost invisible increase in the heat. What it's doing is really pervasive, and yeah.
Right. And yeah, I think that's a really good way of describing it too. It's it's invisible, right? You don't see it. Like you see the smoke, and I mean I could see it out the window where I am right now. I could last year when we had those fires going on, it was like this big thick plume of smoke that I saw every day for a couple of weeks, and it's stark and visual,
Deadly.
but heat itself is silent and invisible. So
Yeah, kind of on that note, this is like a very, very big picture question, but I imagine with all of these different things that are kind of happening simultaneously, it'd be really easy for whether it's doctors or politicians or whoever it is to kind of treat each thing individually and just be like, oh yes, we're seeing a rise in asthma, we're going to divert funds to asthma research, and oh yes, we're seeing issues with extreme weather, like let's put more money into our disaster relief or whatever, and kind of like treat each individual thing. So have we seen people start to tackle like kind of more of like a big picture systemic, like let's like those sorts of solutions? Or
I think there's some momentum there. I mean, it's hard, right? Because if you are a medical professional or you're, say you're a practicing family doctor, right? And, maybe you saw my presentation and like you've done some research and you know that climate affects health, you still can't do all that much in your capacity, right? Like it's such a huge problem that requires action from so many people that even if, all of the medical societies got together and made statements, which a lot of them have, and there's a lot of push in that direction. It's still not necessarily going, like they don't necessarily have the power to say, okay, we're going to stop fossil fuels, right? It's outside of their scope and what they're able to do. I do think it's something that there's greater visibility of these connections now. I know that there's a push from kind of people in the climate and health area to have doctors, if they're comfortable, talk about these, links between climate and health when they can, because those people tend to be really trusted in terms of, being people who can communicate science, and they are people who typically, especially when they're in those family physician roles, they develop these relationships, and they can kind of help spread the awareness of these connections. But yeah, it's tricky because there's just so many layers, and the people who have the ability to make these decisions are not necessarily the people who might be attuned to these particular consequences.
Yeah, collective action at all is hard, let alone collective action that requires people of a lot of different specialties and levels of understanding. And
right,
yeah,
and around the globe too, coordinating
yeah,
around different nations with different priorities.
yeah, that's really interesting. All right, well, any other questions for Ryan before we wrap up? All right, if not, I think we are good to go for today, because we just have Ryan today. So thank you so much, Ryan. That was really, really interesting. Like you said, it doesn't trickle into the mainstream so much. So it's really, really fascinating to hear about, how this plays out for us. So thank you.
Yeah, you're very welcome, and thanks for putting this together. I think it's a really cool opportunity.
Yeah, absolutely. And thank you, Nance and Joan, for joining us today. Like I said at the beginning, we'll probably take a little bit of a break, but hopefully you'll be able to join us for a future event soon.
Awesome. Well, have a great